Have you ever felt dizzy, lightheaded, or even fainted unexpectedly? If so, you might be dealing with low blood pressure, also known as hypotension. While high blood pressure often gets all the attention, low blood pressure can be just as concerning, especially when it leads to symptoms that disrupt your daily life. Many people struggle with understanding how to manage low blood pressure at home, but the good news is that there are simple, effective steps you can take to raise your blood pressure and feel better. In this video, we'll explore how to increase low blood pressure at home with practical tips that you can start using today. Understanding low blood pressure. Before we dive into the solutions, let's quickly cover what low blood pressure is and why it matters. Blood pressure is the force exerted by your blood against the walls of your arteries as your heart pumps it around your body. It's measured in millimeters of mercury, mmHg, and recorded with two numbers: systolic pressure, the top number, and diastolic pressure, the bottom number. Systolic pressure measures the pressure when your heart beats, while diastolic pressure measures the pressure when your heart is at rest between beats. Low blood pressure is generally defined as a reading lower than 90/60ths of a millimeter Hg. While some people naturally have low blood pressure without any symptoms, others may experience dizziness, fainting, fatigue, or even shock, which requires immediate medical attention. Why it's important to manage low blood pressure. While having low blood pressure is not necessarily dangerous for everyone, it can become problematic if it leads to symptoms that affect your daily life. For example, chronic low blood pressure can reduce the flow of blood to your organs, causing dizziness, blurred vision, and even fainting. In severe cases, it can lead to shock, which is a medical emergency. Managing low blood pressure is crucial to maintaining your overall well-being and preventing potential complications. Fortunately, there are several ways you can increase your blood pressure at home without needing to rely on medication. Simple lifestyle changes to increase low blood pressure. Let's start with some simple lifestyle changes you can make to help raise your blood pressure. 1. Increase your salt intake. Unlike people with high blood pressure who need to limit their salt intake, those with low blood pressure may actually benefit from adding a bit more salt to their diet. Salt helps your body retain water, which can increase blood volume and, in turn, raise blood pressure. However, it's important to consult your doctor before significantly increasing your salt intake, as too much salt can have other health implications. 1. Drink more fluids. Staying hydrated is essential for maintaining healthy blood pressure levels. Dehydration can cause your blood volume to decrease, leading to lower blood pressure. Make sure you're drinking plenty of water throughout the day, especially in hot weather or during exercise. In addition to water, electrolyte-rich drinks like sports drinks can also help maintain a healthy balance of fluids and electrolytes in your body. 1. Eat small, frequent meals. Large meals can cause a drop in blood pressure, especially in older adults. This is because the body redirects blood to your digestive system after eating, which can temporarily lower blood pressure. To avoid this, try eating smaller, more frequent meals throughout the day instead of 3 large ones. Additionally, including healthy snacks between meals can help maintain your energy levels and keep your blood pressure stable. 1. Wear compression stockings. Compression stockings are often used to relieve the pain and swelling of varicose veins, but they can also help prevent blood from pooling in your legs and improve blood circulation, which can increase blood pressure. These stockings apply gentle pressure to your legs, helping push blood back up toward your heart and preventing it from pooling in your lower extremities. 1. Avoid sudden position changes. If you have low blood pressure, you might have noticed that standing up too quickly can make you feel dizzy or lightheaded. This is called orthostatic hypotension, and it happens when your body has trouble adjusting to changes in position. To prevent this, try standing up slowly and carefully. When getting out of bed, sit on the edge for a few minutes before standing up. This allows your body to adjust and helps reduce the risk of dizziness or fainting. Dietary tips to boost blood pressure. In addition to lifestyle changes, certain foods can help raise your blood pressure naturally. 1. Increase your intake of caffeine. Caffeinated beverages like coffee and tea can temporarily raise your blood pressure by stimulating your cardiovascular system. If you have low blood pressure, drinking a cup of coffee or tea in the morning or after meals can give you a boost. However, be mindful not to overdo it, as too much caffeine can lead to other health issues like anxiety or insomnia. 1. Eat foods rich in B12 and folate. Vitamin B12 and folate are essential nutrients that help produce red blood cells and prevent anemia, which can lead to low blood pressure. Foods rich in B12 include eggs, meat, fish, and dairy products, while folate can be found in leafy greens, beans, and citrus fruits. Including these foods in your diet can help maintain healthy blood pressure levels. 1. Consume salty snacks. As mentioned earlier, salt can help raise your blood pressure. If you're looking for a quick fix, snacking on salty foods like pretzels, olives, or salted nuts can provide a temporary increase in blood pressure. Just remember to balance your salt intake with plenty of fluids to stay hydrated. 1. Add licorice to your diet. Licorice root can increase blood pressure by reducing the effect of aldosterone, a hormone that helps regulate the balance of sodium and potassium in your body. While consuming licorice in moderation can help raise blood pressure, it's important to use it cautiously and under the guidance of a healthcare provider, as too much licorice can cause serious side effects. When to see a doctor? While these home remedies and lifestyle changes can be effective in managing low blood pressure, it's important to know when to seek medical advice. If your low blood pressure is causing severe symptoms like fainting, confusion, or chest pain, or if it doesn't improve with home treatment, consult your doctor. They can help determine the underlying cause of your low blood pressure and recommend appropriate treatments or lifestyle adjustments. Low blood pressure can be a challenging condition to manage, but with the right approach, you can take control of your symptoms and improve your quality of life. By making simple lifestyle changes, adjusting your diet, and knowing when to seek medical help, you can raise your blood pressure to a healthier level and reduce the risk of complications. Remember, it's always important to listen to your body and consult with your healthcare provider to find the best plan for you. Thank you for watching, and I hope these tips help you feel more confident in managing your low blood pressure at home. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and advice. Stay healthy and take care.